So, how is it even possible that a single molecule from a mushroom can create these profound, lasting changes in the brain after just one experience? Well, today we're diving deep into psilocybin. It's a powerful compound that's no longer on the fringes. It's right at the forefront of neuroscience, and it's completely shaking up how we think about the brain and mental health.
All right, so here's our game plan. We're going to follow the molecule's journey from start to finish. We'll see how it acts as a chemical impersonator, and then how it actually rewires our brain's networks. From there, we'll look at how it's used in therapy, check out the absolutely stunning clinical results, and finally, and this is super important, we'll cover the risks and responsibilities that come with a tool this powerful. Okay, first things first. To really get a handle on psilocybin's power, you have to understand what it is on a chemical level and the incredible trick it plays on our own brains.
Now, here's a super important distinction that a lot of people miss. The psilocybin you find in mushrooms, that's not actually what does the work. When you ingest it, your body does this little bit of chemical magic and converts it into psilocin. That's the molecule that actually gets into the brain and makes things happen. And this is where it gets really cool. The whole secret is in its disguise. On the left, you've got psilocybin, and on the right, serotonin, our brain's natural mood regulator. I mean, just look at them. Their chemical structures are so alike that psilocybin can basically walk right into the brain's serotonin system and pretend it belongs there. This mimicry is the key to everything. But here's the twist. It's not a perfect impersonator, and that's actually its superpower. You can think of your natural serotonin like a sprinkler system. It kind of sprays all over the place, hitting dozens of different receptors in the brain. Psilocybin, on the other hand, is like a master key. It doesn't bother with all the other locks. It goes straight for one very specific receptor and turns it with incredible force. And this highly targeted action is what creates such a unique and powerful experience.
So we've got our master key. Now let's go see what happens when we stick it in the lock and how it can completely overhaul the brain's entire communication system.
That master key fits a very specific lock, the serotonin 5H2A receptor. And what's crucial is where these receptors are located. They're not just scattered everywhere. They're packed into the most evolved parts of our brain, the areas that handle complex thought, our sense of self, and, really importantly, our visual processing. That high concentration in the visual cortex, that's the direct biological reason people report such vivid, geometric visuals, even when their eyes are closed. On any given day, your brain is a model of efficiency. It's highly organized, or what scientists call modular. The vision part talks to other vision parts, the hearing part talks to other hearing parts, and so on. It's kind of like a big company where every department sticks to its own floor and only communicates through official memos. Then psilocybin comes along and just demolishes the office walls. All of a sudden, the visual department is having a deep conversation with the emotions department, and the memory department is brainstorming with the auditory department. This explosion of crosstalk is why you see things like synesthesia, where people might hear colors or see sounds. The brain just becomes this globally connected, hyper-integrated network for a few hours. But, and this is a huge but, just rewiring the brain isn't automatically a good thing. As neuroscientist Andrew Huberman puts it so well, the change has to be adaptive. It has to actually help you. The goal isn't just to create change for the sake of change. It's to guide that change in a way that's truly beneficial. And that all comes down to the context of the experience. So if the molecule opens the door to brain change, how do you steer that change in a positive therapeutic direction? Well, the answer lies in two little words that are absolutely everything in this field: set and setting. This whole framework is non-negotiable for therapy. Set is your mindset, the intentions you bring with you. Setting is everything else, a safe, comfortable space, trained, sober professionals to be there if things get tough. And crucially, tools like an eye mask and headphones, those aren't just for atmosphere. They are essential for tuning out the external world so you can really focus on the internal one. The whole journey usually follows this predictable path over 4 to 6 hours, but the real therapeutic magic often happens during the peak, right around hours 2 and 3. It's so important to know that peak here means peak intensity, not necessarily peak fun. This is often when tough emotions or anxieties can come to the surface, which is exactly why having that guided setting is so critical. And right at the heart of that peak intensity is often an experience called ego dissolution. It's this temporary feeling where your sense of I or me just dissolves. For people who are stuck in really rigid negative thought patterns, like in severe depression or addiction, this can be an absolute game changer.
It gives them this rare chance to step outside of themselves and see their life and problems from a totally fresh perspective. Now, I know this all might sound a bit mystical or subjective, but over the last few years, rigorous clinical trials have been putting hard numbers to these experiences, and the results, they're the reason the entire medical world is sitting up and paying attention. This chart says it all, really. Effect size is just a way of measuring how well a treatment works. On the right, that's the effect size for our standard antidepressants. It's pretty modest. On the left, that's psilocybin therapy. It's not just a little bit better, it's a jaw-dropping 4 times more effective. We're talking about a complete paradigm shift in psychiatry. So what does that look like in the real world? It means that somewhere between 60 and 75% of patients, many of whom have suffered from severe, treatment-resistant depression for years, find significant, lasting relief after just 1 or 2 guided sessions. Those kinds of numbers are almost unheard of. And while the evidence for depression and end-of-life anxiety is rock solid, the research is branching out fast. We're seeing moderate evidence for its use in alcohol and tobacco addiction, and early studies are looking at things like OCD. The map of where this could be useful is still being drawn. Okay, with all this incredible potential, we absolutely have to be just as clear about the very real risks. This is a profoundly powerful substance. It is not for everyone, and being honest about the risks is a core part of the scientific approach. Clinical trials have extremely strict rules about who can participate, and for very, very good reasons. Anyone under 25 should avoid it because the brain is still developing. And most importantly, anyone with a personal or family history of psychosis, like schizophrenia or bipolar disorder, must stay away. Because psilocybin can so powerfully disrupt brain function, there's a serious risk it could trigger a psychotic episode in someone who is vulnerable. This is a non-negotiable safety line. And of course, you have to remember the legal situation. Despite all this promising research, psilocybin is still a Schedule I illegal drug at the federal level in the U.S. It's only legal within approved clinical trials or a few specific state programs. This explainer is just for educational purposes. It is not a recommendation for use. And that brings us to a really powerful analogy from Andrew Huberman. He says that psychedelics are like sharp blades. In the hands of a skilled surgeon in a controlled therapeutic environment, they can do incredible things. But if you're careless, you can get cut very badly. The entire future of this molecule depends on us learning how to use that blade with wisdom, with caution, and with a whole lot of respect.